Hi, my name is Kari Ryman, and I'm a certified nurse midwife. And today I have with me Tiffany Muniz. She is a certified doula, certified lactation counselor, and does a placenta encapsulation. She's been a doula for almost 4 years, servicing the St. Louis, Missouri area and the Metro East Illinois area. She supports families planning both home birth center and hospital birth, and she left her medical career about 6 years ago at the birth of her son because she had such a great experience at a birth center birth. So today we'll be discussing doula support with Tiffany, so let's dive right in. So let's start with a basic question. What exactly is a doula?
So the way that I usually describe it to people is a doula is just a support person. So usually for pregnancy, for labor, and then the immediate postpartum time period. So what we do is we provide our clients with lots of different information, educational information, and then also like physical support and emotional support, throughout the time period.
So what does that look like? Do you see your clients before the birth to kind of get to know them? How many visits do you see them? And then how much time are you with them during the birth experience?
Yeah, so for my clients, each of my clients gets 3 visits with me prenatally. And this is just a time for us to meet each other, to become comfortable with one another, to go over their birth preferences and what they're kind of envisioning for their labor and birth experience. And then I am usually with my clients throughout the entirety of their labor. So whether that's like 2 hours or whether that's like 40 hours, I'm with them the entire time. And I stay with my clients usually a couple hours postpartum. And then I see them 1 or 2 times postpartum as well.
Right. So what do you see is your biggest role in the day or at the day of the birth? What are you doing physically? What are you saying? How does it actually look to have a doula at your side?
Yeah, so a lot of it is emotional support. Just like giving them affirmations and letting them know like this is a normal process and you're doing everything right and you've made all the right choices to get here. A part of it is physical support. I do have a large chunk of my clients who really want a physiological unmedicated childbirth. So some of that is physical support. So, like those hands-on comfort measures, hip squeezes and counter pressure and reminding them to take a drink and reminding them to breathe and, reminding them really not to get in their own head about things.
Yeah, great. And I have had some patients who ask me when I recommend a doula, well, will that make my partner or my husband feel like they're not involved or they're pushed to the side? What's your response to those kind of hesitancies?
Yeah, I have to be honest. My husband was the same way. Whenever I said, "Hey, I really think that we should get a doula for our son," he was like, "I don't understand. Like, this is supposed to be my job. I'm supposed to be the one supporting you." And then we decided to take a childbirth education class, and he realized, wow, I don't really know all of these ways to support her. So really what I tell people is we work as a team. Yes, your partner or your husband is going to support you, and so am I. Hopefully, we can work together as a team to make everyone have the best experience possible.
Right. And I've seen the benefit of doulas for the partner, especially if things are stressful. The partner can take a little break or there's a doula there with the expertise of what is happening to help explain things as they go along. So it's a really great partnership between.
And it takes all the pressure off of the partner to be the main support person. That can be, birth is really stressful regardless, if it goes exactly how you want it or if it goes, the complete opposite way. But it takes the stress off of the partner not to have to be the main support person.
Right.
Yeah.
So do you recommend that every pregnant person have a doula or only people with plans for unmedicated birth or what's your suggestion for that?
Yeah, I think it's a good idea, regardless of what type of birth that you're planning, to hire a doula. I've had clients who, from the very beginning, are like, okay, I want an epidural. Sign me up for all the medication, but I still want you there. Because they understand, one, you usually can't get an epidural as soon as your labor begins. People aren't usually going to the hospital at the very beginning when they first have contractions. So, I can provide that physical and emotional support beforehand, before you even go to the hospital. And then again, like once we get to the hospital or your birthing location, help with positioning. If you have an epidural, you can still move around and that's what we want. And then same with a cesarean. I can help with advocacy and making sure that you still get the things that you're wanting out of your birth.
Well, that's awesome. I think it's great that you have that advocacy approach for your patients, regardless of what their goals are. If you have one thing that you think is the biggest benefit of hiring a doula, what would that be?
The biggest benefit. There are lots of benefits, but I think overall, probably the number one benefit that we see, even when we look at the research about doulas and support people, is that women who use doulas have a higher satisfaction of their overall birth experience. And what we know about birth experience is if you have a really bad birth experience, that affects how you are in your regular everyday life. You have an increased risk of postpartum depression and anxiety, and that really affects the way that you function as a person. So, and then we know that when people have higher satisfaction, they feel better afterwards. So I would say that's probably the number one thing about having a doula.
Yeah. And that patient satisfaction can translate to their ability to feel confidence in those first few weeks of motherhood with all the difficulty and newness that's there. Yeah. So I agree that that's a really important part of it. So you've seen a lot of births in your doula work. You've worked with both midwives and doctors, I understand. Can you talk a little bit about the differences that you see between midwifery care and OB care?
Yeah, so I would say the biggest difference is that midwives generally have a better understanding of what physiological birth is.
And can I stop you right there for a second? What does that mean? For people who aren't familiar with that term, what is physiologic birth?
So physiologic birth is really just the body's innate capability to birth humans. It's literally what women's bodies were made to do. A lot of times that means just kind of leaving things as they are, not intervening unless absolutely medically necessary. OBs are great for emergencies or for, people who need to have their care like medically managed. But one thing I've noticed as a doula is that a lot of times birth happens and it works really well on its own. So I would say that would be the biggest benefit of midwives versus obstetricians. A lot of obstetricians, at least in my experience, they tend to look at birth as this medical event, whereas midwives look at birth more in like, this is just something that happens to us and we're here if you need us, but otherwise we're just going to let you do your thing.
Right. Yeah. Seeing it through a different lens. One is looking at the medical management model, and the other one is seeing it, like you said, as a normal, healthy process in a woman's life. If you could say one piece of advice for expectant families, what would your best advice be?
So I think my best piece of advice would be to take an out-of-hospital childbirth education course. Out-of-hospital childbirth education courses tend to teach lots of things. So not only do they teach you about pain medications, but they teach you about other comfort measures that you can use throughout the process. They teach you about all of the interventions that you may or may not see when you're in labor. They teach you how to care for yourself and your baby in the immediate postpartum time period. They help you become prepared for that point. Yeah.
And I've noticed that a lot of people who take those private classes come out feeling that they were empowered to know that they have decision-making power within the hospital structure, and they have the ability to say yes or no to all the interventions that were reviewed in those courses. So I think that self-advocacy and learning about patient autonomy that's found in those private classes are really beneficial. Thank you so much for sharing. And if people want to find more out about having a doula or specifically hiring you for a doula, where would they go for that information?
Yeah, so you could reach me through my Facebook or my Instagram. My handle is just @thedoula_Tiffany. Yeah.
Awesome. That makes it easy. And we'll have links in the description below so that people can easily find you. Thank you so much for your time today, Tiffany. We really appreciate you talking with us.
Thank you so much for having me.
We just finished talking with Tiffany Muniz, a birth doula. We got to hear a lot about what a doula is and what role they play in the prenatal, pregnancy, and postpartum periods. If you have more questions or want more information, you can look in the description below and click on those links. And again, thank you so much for watching.